Hello, this is Dr. Bhatti, and in the next episode, we are going to discuss about why increasingly patients are opting for body hair transplants even for lesser degrees of male pattern baldness. So that you do not miss out on future episodes discussing medications, hair loss treatments, and results of hair transplant, do not forget to subscribe to my channel. There is so much bad press today about oral Finasteride that people, even with the most rational minds, will not listen. They will not listen to reason. Clinics are dealing with this problem in their own different ways, in their own innovative ways, by devising various treatments, various ways to convince patients into using alternatives that most of them know do not exist, so that they do not lose out on patients. Suggesting various formulas that they convince patients that will work in place of Finasteride. And these formulas, these potions and lotions are available in their counter, in their pharmacy, in those clinics. And these treatments are, mind you, very costly, because the normal human psyche feels that a costlier treatment will be more effective. People do not understand that in so doing, they are wasting precious time when baldness is creeping into their hair. The androgenetic alopecia gene does not sleep. It is surreptitiously gaining ground as you try various combinations, various formulations that are being sold to you in the marketplace. And especially this is true for young people who are, say, around 22, 23, and that is the time when they should be on DHT blockers, but they are trying all sorts of treatments because we all live on hope. And since, especially in this age, because baldness is very progressive, very aggressive in fact, precious time is lost by not taking oral DHT blockers. The costlier the treatment, the less likely are we to accept the fact that this treatment did not work. That is why we are getting convinced and increasingly opting for treatments like stem cells, PRPs, topical Finasteride, topical dutasteride, in the hope that you will not lose hair. But precious time is being lost. This is what we fail to understand. This trade of selling magic potions and lotions for hair loss ailment is ages old. The first recorded treatment evolved for hair loss was in 3000 BC. Some even suspect that treating hair loss is the second oldest profession in the world. And if this magic lotion that you have been advised to take has worked, please check whether your baldness is stable or not. Just go off this treatment for about 3 months and you will know. Cutting the long story short, if you do not fall in these three categories, you just cannot do without Finasteride. And these three instances are, number one, your baldness is stable even without Finasteride. The baldness is not evolving. It has stopped evolving for the past 2 to 3 years, or probably 5 years or 10 years. So it is not likely that it will evolve any further. The baldness gene has most likely gone to sleep or has switched off. So in these cases, you need not take Finasteride. Even if you have to take it for a very short period of time after a hair transplant. But no long-term treatment using Finasteride is required. The second category is when hair transplant is needed for indications other than androgenetic alopecia. And this may be for correcting a high forehead. A high forehead is a trait, it may not be androgenetic alopecia. When you need facial hair transplant, like for eyebrow, for mustache, for beard, using body hair, or due to tractional alopecia, where alopecia happens due to constant stretch. And lastly, if the hair transplant that you got is mostly body hair transplant, there is very little that you need to worry, because body hair are immune to the influences of DHT on the hair. So this is the reason why in my clinic, even for lesser grades of baldness, say grade 3, grade 4, I advise routinely for the patient to have a fair sprinkling of body hair in the transplant. Because mostly I have seen that patients are not compliant to treatment. Maximum period of time most patients take treatment is for 6 months and 12 months. And after progressing baldness takes its toll, they are repentant. They come back to me and they say that had they known that this is going to be the ravage of progressive baldness in their case, they would have not stopped Finasteride. But the bad press about Finasteride is such that it keeps patients away from Finasteride. Finasteride, the only elixir, the only cure-all for androgenetic alopecia. So this is the reason we are doing more and more body hair transplant, even in lesser degrees of male pattern baldness. Body hair flourish in an environment of high DHT. And this is the DHT paradox. And this is why we make full use of the DHT paradox in our clients who have grades 3, 4 and lesser degrees of grade 5 baldness. So that is the message I wanted to convey to you in this video. If you have any further questions, I'll be very happy to answer. Please leave a comment in the comment section below and I'll get back to you. God bless you.